Where are the real lines between normal childhood behavior and first signs that deserve professional attention?
Whatever kids do, they do because they are kids. And they are supposed to do that. If we do something like that, then it becomes abnormal. But when kids do something what kids are supposed to do, I think it's not abnormal.
Would you tell such mothers who have neurodiverse or parents who have neurodiverse children, and who get to know about the diagnosis, how they can handle it better?
When that first word comes, mummy, papa, ma, I think the kind of happiness that parent would have, no one of us can even imagine that.
Say for instance was somebody who would not talk at all.
Early intervention, early therapies and early work that we started with the child helped him to achieve most of the delays. Most importantly, I think stop correcting your child for every small little thing. And if you want to correct the child, especially modern parents, first build that bond verbally. But body language तो correction वाली ही रहती है, इसीलिए deal crack नहीं हो रही है. Firstly, meltdown word is a huge word, It shouldn't be used so lightly. Anxiety, depression, they are used so lightly.
Today, I'm excited to welcome Mrs. Nisha Jain, founder, director of Vatsalya Legacy Education Society, a counselor, psychologist, a change maker, and a powerful voice in mental health, inclusive education, and child safety. With years of work across children, parents, professionals, and communities, she has created impact through counseling, training, innovation, and leadership. I am really looking forward to our conversation today because I know it's going to be insightful, meaningful, and full of warmth. So every parent says, my child isn't listening anymore. Is today's children actually becoming more difficult? Or are today's parents raising children in a way that human brain was never designed for?
Manpreet, tantrums and behavior issues were always there. It's not that these things are new. It's not even this that the parents are not able to handle this or human brains are designed differently. I think the approach between the parent and the child as a relationship, parent-child relationship, has drastically changed. And this has also to do with the kind of overload information that we have around us and of course technology. But the problems were always there.
So can you tell a little bit more about how do you see this relationship that has changed that you just referred?
I think changed in a good way also and changed in something that we can question also. The good way is that the parent is much more aware than what he or she earlier was. But the awareness is so much that the parent is also confused whether this is right or that is right for my child, what is going to work and what is not going to work. So earlier parenting was a lot on instinct also. A parent would know कि ना ये चीज तो मेरे बच्चे के लिए हो ही सकती है या चल ही जाएगी. But because of so much of information around us, most of the parents, including us, we have started questioning that instinct as a parent. And I think that is the confusing state and that is the approach that I'm talking about.
So rather than working intuitively, a lot of times we feel कि ये सही भी है कि नहीं है.
Yeah, we question, हम खुद को ही question करें. We also call it as self-doubt. कि करे या नहीं करे. मतलब कई बार हम जो instinctively करते हैं वो most of the time those things really work when it comes to parenting. But थोड़ा सा अभी ये challenging तो हो ही गया है. I would say that.
So in your recent practice, have you gotten any particular incident where you saw that the parent was just too doubtful about what he or she was doing with the child?
So I would tell about a parent whose child is not a neurodiverse child but a neurotypical child, and the parent knew that the child has some kind of fear with cats and dogs, and specifically with cats and dogs and not other animals. But then the social media and friends and couple of people around them tell नहीं ये सब कुछ नहीं होता, ये तो नाटक है, बच्चे ऐसे ही चिल्लाने लग जाते हैं, and all of those, how people tell things around us. And that 13-year-old girl was always anxious because when we are in India, cats and dogs are part of our lives. It is everywhere. And the child was always on edge. On edge, matlab nervous system fully activated all the time. Means with that kind of fully activated nervous system, if the child is going to the school, it's about, it's very obvious that the child will have tantrums, the child will have behavioral issues, the child will have anger tantrums, everything, because the child is fully activated. And in spite of the parent knowing this, that this is because subah something happened and the dog had come in front of the child, and the parent said, नहीं ऐसा कुछ नहीं होता, तुम फालतू में डरते रहते हो, and the child went crying to the school. So this is for the parent who knew that ये problem है. Rather than seeing what the world is telling, it is better to understand that I first start working on this fear rather than taking it to a limit where everything else also starts changing in the child's life.
Right. So interesting. And you work with children across autism, ADHD, anxiety, speech delays, and behavior challenges. What are the 3 things you observe about a child before anyone else talks about it?
I think when a child first comes to me, they are usually with their parents. So, first thing I would check is connection. That what is the connection between the child and the parent? Second is, how is the child self-regulated? Third is whether the child is present in the present moment or not. So these are the 3 things that I would definitely first see in a child who's coming to me.
Amazing. And how do you do that? Very interesting.
So connection is very simple, how the child is in front of the parent and how the child is without the parent. So when we take our full 60-minute session, the child is 30 minutes with the parent and 30 minutes without the parent. So the connection is very, very clear, because the child is absolutely different if the connection misses. Absolutely different when the parent leaves the room. Right? Self-regulation means how much fidgety the child is, nervous system कैसा है, बैठने में कोई problem तो नहीं हो रही है, sensory issues तो नहीं है. And these things you can't hide more than 5 to 10 minutes. वो भी ज़्यादा बता रही हूँ मैं. If you're a child, adult you're not able to, 15-20 minutes से ज़्यादा आप भी नहीं handle कर पाओगे. So that is the regulation. And for the third part, it is very simple. We have some very simple basic questions जो हम client से पूछना start करते हैं. When it comes to a child, we have child-centric questions. For adults, we have different questions, and for seniors, we have different questions. So those questions are a lot around play, around Bollywood, Hollywood, around food, around all the basic things that a client or a child would use and see, and I would say that they would use it every day on the regular basis. उससे हमें बहुत कुछ पता चल जाता है कि whether the child is understanding कि वो यहाँ पे क्यों आया है, उसे किस चीज की जरूरत है, does he even know that he's come here for some kind of help, and the most important thing, the child needs help or the parents need help. वो हमें उस 30 minutes में पता चल जाता है. And trust me, in 60% of cases, it's the parents who needs help and not the child.
Yes.
और parents ये सोच के लाते हैं कि बच्चे को मदद की ज़रूरत है.
Right. Absolutely. Great. And I think I also loved when you said that, sometimes when you see children with parents and without parents, that gives you a connect between what is the connection. So why do you feel the connection is so important, and what could not having the right connection do to children?
This is a very beautiful question, and I would say just in one line that connection इसलिए नहीं है because most of the parents are busy in correction. इतना correction में busy हो गए हैं that they just forget that first we need to build the connection and correction will automatically happen. But वो usually उल्टा ही चल रहा होता है. And I think that's where the main and the basic first step of a relationship anywhere, whether it is parent and child, whether it is husband-wife, whether it is teacher-student, it starts with correction. And that's where the problem comes.
So true. I think a lot of times when teenagers or even, children come to us for nutrition advice, I see mothers, a lot of times, ye nahi khata hai, ye nahi karta hai, a lot of times because I think we just too much looking for perfectionism in everything, because I think a lot of times we judging ourselves for how our kids are performing or, how the teenager is performing and everything, but very valid.
So this also reminds me of a very, very, small conversation that I had with a parent who had come to me for a session saying that my son doesn't want to get married or isn't ready to get married. So then, of course, I was building up the conversation with the son also, and he said, "ये issues होते हैं, ऐसे issues होते हैं." And then the mother just interrupted कि कौन सी लड़की में प्रॉब्लम नहीं होगी, प्रॉब्लम तो होती है, फिर बदलता रहेगा ये, उसको जो भी प्रॉब्लम आएगी तो आप शादी बदलने के लिए या किसी और की चीज़ों को करेक्ट करने के लिए थोड़ी ना कर रहे हो, तभी तो प्रॉब्लम्स आ रही है. मैरिज इज ऑल अबाउट whatever the person is, accept the person, and it all begins with love and it ends with love. बीच में correction थोड़े बहुत आते रहते where both the partners have to keep doing the corrections. But the beginning, the nave of the marriage, the building block cannot be correction, no? That you enter with the word correction and then you feel that I have a connection with my partner, it is not going to happen.
Right. And I'm sure, Nisha ji, as a lot of young parents or old parents are hearing you right now, this is very natural because I think we also come from a decades of parents who always corrected. And I remember when I was a young child, we were also beaten when we were not doing things right? Yes. So I think luckily now that's not part of the school culture anymore. Yeah. But then, for instance, somebody who's seen it all their lives and, now they see themselves as very corrective parents. What are two things that they can start doing today to build up that bond with their children, whatever age they may be?
Should I be brutally honest?
Yes.
I think they should start minding their own business. That says everything. Once they start minding their own business, I think the connection will automatically happen. Problem wahan aa rahi hai that they don't mind their own business and they get into the child's business most of the time, even when they grow up.
Yes.
And that's where you will see that even if in India, where there's culture of joint families, where there are 3 generations living together, but in the same house, all the 3 generations are in 3 different rooms. They can never come out together and connect with each other because none of them are minding their own businesses. Everybody is minding somebody else's business. So I think they should just mind their own business.
Right. Amazing. So parents often say he's just naughty or she'll grow up. Where are the real lines between normal childhood behavior and first signs that deserve professional attention?
That's a very nice question. So there is nothing called as normal behavior. ये बच्चों में पता नहीं कब से आ गया है normal behavior and abnormal behavior. Whatever kids do, they do because they are kids and they are supposed to do that. If we do something like that, then it becomes abnormal. But when kids do something what kids are supposed to do, I think it's not abnormal. But yes, when a professional advice is required when you see any of the behaviors or any of the skills regressing. जो बच्चे ने सीख लिया है, जो बच्चे को आता था, अगर उसमें regression आने लग गया है, then you need to have a professional advice if the child is neurotypical. Neurodiverse अगर है, then of course things are different. But even in neurodiverse, not all neurodiverse children are same. All neurodiverse will have some unique things and some different things. That even then intervention is required only when regression is a part of their life on a daily basis. कि कुछ सीखा और बच्चा regress हो गया या कुछ आता था और बच्चे ने regress show कर दिया, then professional advice is a must, I would say.
Got it. Okay. After years of working with autistic children, what's the biggest misconception about autism that still is harming kids today?
Oh, most of the people think that eye contact नहीं है तो autism है. But eye contact has nothing to do with autism. It is one part of it. But I think this is one of the myths that no eye contact is equal to autism.
Right. And many parents secretly ask, did I do something wrong after a diagnosis? Which is usually harder? Is it harder for parents or for kids?
So, After early intervention, which we of course say that when it comes to intervention, it is better to get it done at 2 rather than getting it done at 6, because it gives the scope of working on the child's milestones. But acceptance point of view, it is difficult for the parent, because now the parent has to be mentally prepared that you know what happens when we have a child. So we know कि इतने साल बच्चे के साथ काम करना है, धीरे 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 बच्चा independent हो जाएगा. This is what usually comes when a parent conceives and when they have a child. But when it comes to neuro diversity, the parent knows that now my entire life is with the child. The child is not going to be completely independent. Completely independent. I won't say that the child is not going to be independent. Completely independent. The parent will have to intervene for a very long time, even when the child grows up. I think that acceptance comes very late to the parent. And of course, I will not deny that if the parents are working or not working, it's not easy. The battle is not a very easy battle. It is something which takes away a lot of their energy, financially, emotionally, socially, physically, in all possible ways. So acceptance is something that they struggle with.
Right. And what would you tell such mothers who have neurodiverse or parents who have neurodiverse children, and who get to know about the diagnosis, how they can handle it better?
First thing, early intervention. The moment you think and you see that things are different, please use your intuition, not other people's intuition. And get the early intervention done. And once you are sure, after all the interventions, that your child is diagnosed with any kind of neurodiversity, start working on the child from day one. And what I would want to say is, keep up the courage, because you are the chosen one for this child. And when you will see the results, it is like achieving the sky. Because when you work with the child, एक बच्चा जो रेगुलर बच्चा है, न्यूरोटिपिकल है, वो 1.5 साल में बोलने लग जाता है, कुछ वर्ड्स आ जाते हैं. But when it's neurodiverse, you work on the speech for years together. And when that first word comes, mummy, papa, ma, I think the kind of happiness that parent would have, no one of us can even imagine that. So I would say, keep up the work and be courageous, because this is going to yield the results that you are working on. And it will definitely give the results.
Right. Amazing again. And Nishaji, what is it that parents can start looking for? Like you said, 2 years, if it gets diagnosed at that age group, it's much easier for intervention. So what are the signs that parents can start looking for, in the milestones of a child, so that they can diagnose or get into an instinct that I need to go to a professional to understand it better?
First is delayed milestones, of course. But not all delayed milestones are autism, because as we know that autism, we call neurodiversity as a spectrum, right? So not all delayed milestones will lead to autism. But the most important thing that I always tell parents to look at is regression. Anything that your child has learned, and if you see regression in that, that's when you should consult. Regression is one thing. Delayed and everything else with developmental delays, with all the kinds of therapies, all of that can be slowly and steadily covered. But when regression comes, you should never delay to go to a professional and take proper help and start working on it. So regression is one very big part of autism. It may not be in other neurodiversities, but autism, yes. Regression is one very big part, and that's where the parent loses it. That's where I always say that more than strength, they need courage to stay there. Because when they work with the child for years and months, and when they feel कि अब बस achieve हो ही गया है, and in a week's time you see that it starts regressing, and the parent have to start again. The therapist have to start again. And that's where I tell the parent that be courageous. You have to stay there no matter what.
Right. And in the space of regression that you're talking about, can you give us some examples which is easier for mothers or parents to understand that, my child is regressing here? Because something as typical as, okay, my child did learn, some of the rhymes and has forgotten it now, could also be taken as regression at times.
No, memory is not something that I'm talking about. I'm talking about, say, your child learned how to suck, right? And after 6 months, you saw that the child is not able to suck now. So that is regression. Now, when the child is 4 years old or maybe 3 years old, the child has one word vocabulary. And then when the child turned 4.5, 5, there is no vocabulary at all. So that is regression. I'm talking about those regressions.
Right.
I'm not talking about that you taught ABCD and the child doesn't remember ABCD. The child may not remember ABCD academically, but may able to recognize ABCD in a different way. So academic regression is not something we are talking about. We are talking about the skill-based regression that the child should have age-appropriate wise.
Right. Perfect. Great. So autism rates have risen drastically over the last 2 decades. Are more children actually developing autism, or are we simply getting better at recognizing it?
So, autism was always there, right? So, I would say that we are getting better, the diagnoses are better, and I would give the complete credit to early interventions that is helping to find and to diagnose autism at the right time and at the right age. So, yes, we are becoming better. The diagnoses are becoming better.
Right. Okay. So parents spend months chasing the cause: vaccines, screen, food, genetic, environmental toxins. What does science actually know today, and what do we still don't know?
So, there is, I would say, science yet doesn't have the answers that what causes autism. As per the research papers that I have read and as per my understanding and the little research that I have done, I think it's a interaction between the biological formation and the genetic formation. But what exactly it is, I think even science is finding answers for that. But it is definitely not screen, definitely not issues while conceiving or a premature birth or something like that. I would say the exact reason we might not know, but it has to do something between the interaction of biological formation and genetic formation, but nothing related to environment and screen and all of that. Screen से अभी बीच में जरूर बात हो रही थी, a lot of screen virtual autism was spoken and it was related to the screen time and all of that, but even science doesn't back this that virtual autism has to do a lot with screen. So not that.
So probably all of these can impact, but we can't say that these are the reasons.
So if you're diagnosed, then food, screen, environment makes a lot of difference. But there is no autism, and if all of this is there in your life, you cannot have autism.
Yeah.
So it is not vice versa thing, right?
Okay. So one child avoids eye contact, other talks non-stop, another speaks very little, another is academically brilliant. Why autism is called a spectrum, and why does this word confuses so many people?
Okay. So because the examples that you have given, one doesn't speak, one is brilliant, one is non-stop talker, and that's the reason that autism is a spectrum. Because consider that the spectrum is between 0 to 10, like consider like an umbrella, 0 to 10. So autism can be 0, it can be between 0 and 5, can be between 5 and 10, and that's where the scoring comes when we use the diagnostic tool. So now when a child is between 0 to 5, there are certain traits that we would see. When the child is between 5 to 8, there are certain traits. Between 8 to 10, there are certain traits. Now these are all even related to age. So even when the diagnostic tool is used, the questions are very different for 0 to 10 months. It is very different for 10 to 3 years, and then 3 to 5, 5 to 7, and it goes on, right? But we call it as a spectrum because with age, the spectrum can change. With age, the attributes can change. I would say how the child is processing, how the child is growing, everything can change, and to fit into that spectrum becomes easier for us when we are checking with the help of the diagnostic tool, and that's why it's called as a spectrum. Because I would say every target area of the spectrum will have different see, the exact word is the different attributes of how we will look into a child when we are doing the early intervention for the child. So using it as a spectrum is much better rather than just labeling the child as autism. So even when it is written on the report, it is written as ASD. So it is written as autism spectrum disorders. The child is here today, can be here in 3 months, can be here in 3 months. So the diagnosis is also accordingly that way.
Right. So have you seen in your practice that, somebody who'd come very early on to you, probably, say for instance, was somebody who would not talk at all, but eventually with a lot of intervention completely changed and, is very, very good at communication, for instance?
Yes. So both the ways we've seen that there was somebody who came with no speech at all, but early intervention, early therapies, and early work that we started with the child helped him to achieve most of the delays, worked on most of the delays. But it has happened other way also, that when a child came to us, the child had some kind of vocabulary, had very little sensory issues, and within a span of 1 year, the child regressed completely with maximum sensory issues, with no vocabulary at all, and difficult to handle the child. So both the cases we have seen, because as I mentioned even earlier, that autism is the main, I would say, symptom of autism is how the child is progressing and how the child is regressing. So that's where it becomes very clear to us that whether it is autism or not.
Got it. Right. And are there anything in the environment that can trigger regression?
So suppose, say if the child is, so we've all heard about, audiovisual, right? So sometimes when a child is very, very sensitive to the audiovisual aspect of autism, that's where the environment can, make some difference because of the kind of place that we live in. Noise pollution बहुत ज़्यादा है. The festivals that we have, the announcements that we have, that can trigger to a certain extent. Not a lot, but yes, it can.
But for instance, if the child is coming from a home wherein parents are fighting, or where the home is not a very safe home for the child, does that also impact regression?
If the child is diagnosed,
yes,
and if the parents are fighting at home,
yes,
of course yes. Of course yes, it makes a lot of difference. The house environment, when it comes to autism, there is one primary caretaker of the child, either the father or the mother. Rest, all of them just become caretakers, but there is one who's the primary caretaker. And if the primary caretaker is not taken care of by the other family members, the direct impact is to the child.
Right.
So that is how the home environment will affect the child. Even at school. So there's one teacher who would be like the primary teacher for the child at school. And if that teacher is not taken well care of, the other children are harassing her, or the other children are, irritating her, this child will show that, he's not happy. He or she is not happy. Why am I not able to do anything? Why people are harassing my class teacher? If that child likes her or his teacher. So yes, environment makes a lot of difference.
Right. And even for normal children's development, we say that they have to feel safe. They have to be in a parasympathetic nervous system most of the time, because anytime they are in SNS for a very long time, it definitely impacts their development. So how important is staying for a child in a safe space in a neurodiversity, in a neurodiverse child, for instance?
Very, very important. And it's not only about neurodiverse or neurotypical. I think it's for all of us that we all should be feeling safe wherever we go, whether it is our home, whether it is our school, or when we go to a restaurant or to a playground. If we don't feel safe, of course, it directly impacts our nervous system. And when it affects our nervous system, it directly impacts the entire, I would say, the framework of our whole body, how we process, how we conduct, how we talk, everything. So I think it's important for all of us to feel safe wherever we are. And of course, if we talk specifically about neurodiversity, then the entire environment, the school environment, the home environment, they have to make the child feel safe and included. कई बार हम सेफ के नाम पे बच्चे को इंक्लूडेड ही फील नहीं कराते कि नहीं उसको कुछ हो जाएगा उसको अलग से बिठा दो. दैट इज समवेयर विच इज नॉट राइट फॉर हिम और हर. सो included also makes the child feel that I am part of it. And when you feel that you're not part of it, I mean, you take it with us individually, when we go out for a party, you may feel that you're invited, but if you're not included, just imagine how your body starts feeling. The same way the child also starts feeling, so that feeling of being invited in the school but not being included in the school is something that 80 to 85% of neurodiverse children face on a regular basis every day. If they are there in the school for 5 hours, the entire 5 hours they feel this.
Right.
And then we expect them to stay quiet. We expect them to not shout or not show the gestures that they are showing or give cues that they are not comfortable. How is it even possible?
Right. That makes me think that rather than, neurodiverse children getting therapy, rest of the population should get the therapy.
Of course, they should be sensitized on how to be with these children.
Yeah.
So many of these children, many of these adults are invited for weddings, for birthday parties, but they are just invited, they are not included. So inviting is very easy. You just have to give one invitation extra. Including is very difficult, which many of us are not even open to.
So what are probably 3, pieces of advice would you like to give all of us to make, anybody around us who's neurodiverse to feel more included, more inclusive, more part of us?
I think first thing is that if you're not comfortable, don't even invite them. But if you have invited them, make sure that your entire party is designed in a way that this person can enjoy, or your entire gathering is designed in a way that this person can enjoy. Whether it's a child or an adult, उससे कोई फर्क नहीं पड़ता है. Second thing is, one thing that I always tell neurotypical children when I go to the classrooms, that one thing that you can learn from neurodiverse is to be authentic. They can't, for them, 2 plus 2 is 4. No matter how you put it. For us, people can try and convince us that 2 plus 2, I can make it 5 for you. But for them, they are authentic. They will always remain authentic. And if you want to learn one thing from them, is be authentic. And it is so difficult to be authentic. So if you are ready to handle a person like that, then only get involved with them in terms of friendships and in terms of relationships, whether it is ADHD, whether it is autism, or whether it is any neurodiversity. So if you have an authentic person, that authentic person will make sure that the relationship also remains authentic, which maybe the other person is not ready to. So involve with that person only if you're ready to have an authentic person with yourself. And third, accept. Maybe, you go to a restaurant, for you, probably seeing 10 people is is very common. It's okay. You may have a very calm down nervous system, and sensory issues will also remain undercover when you see 10 people. But maybe for that person, it's not that common. So be empathetic towards it. There are children with neurodiversity who would not like many people around them, who would not like a lot of noise around them, who would want to be in a space which is very, very comfortable for them. So create that for them if you really want to do something. And don't stare at them, most importantly. So when they go in trains and when they go in the buses, or when they are loud, usually ADHD children speak very loudly at the airports or at the counters or at the restaurants. Don't stare at them. It's okay. I mean, there are, मतलब इतने जने भगवान ने बनाए तो कुछ तो अलग होंगे ही ना. सब आपके जैसे तो नहीं हो सकते और हमारे जैसे तो नहीं हो सकते. So stop staring at them. Stop making them feel that you are different.
Right.
I think these are the 3 very basic things that you can do.
Absolutely, absolutely. And like you said, that these days we are doing better diagnosis, and I think parents have also gotten to know more about the diagnostics, available. But then, for instance, there are people who are adults now, never diagnosed of autism. What are the signs that they can see so that they now know that they can seek professional help?
Adults as in completely grown up adults you're talking about? Regression is something even they will see. And they can analyze it themselves that yes, there is something not okay with me. Sensory issues that they will see. What they can do and they can take help is in terms of managing people around them now, because now they are grown up, they are probably working or they are into a family. So all they can do is they can take therapy sessions to handle people around them in the right way, making them feel safe and making himself or herself feeling safe in front of them. Other than that, I think that person after so many years, I'm assuming you're talking about an adult who's already 35, 40 years old. So this person has built his or her own coping mechanism. And that coping mechanism is working beautifully till the age of 35, will also work further. Only thing that will bother him is people management. That is where people who are not diagnosed with autism face difficulties when they grow up and when they get to know that there is some issues with them, because now information is around us. So all they need to learn is about people management after their coping mechanism starts working with them. People management is required, because तभी उनके relationships थोड़े से break होने start हो जाते हैं.
And can you give us some examples of regression in adults?
Yeah. So presently I'm working with an adult who's almost 43 years old. He's forgot how to read and write. Yeah. And he was working in an MNC. He's forgot how to drive. He's forgot the sense of directions completely, what is left, right, and backward, forward, everything. Sometimes he forgets how to use the fork and the spoon. So that's where regression is all about. And it's just been I think 2 weeks that I've met him, and I think when we'll go further with him, we'll get to know that there are a couple of things that's affecting him now.
Okay. If intervention starts at age 2 instead of age 6, what changes inside a child's developing brain, and why does timing matter so much?
So it's as simple as that. Medically, when we see that there's a small inflammation in our body or there's a small cut in our body, we should not wait for it to get worse and then go to the hospital and take bigger, treatments around it. Similarly, when you do early intervention at the age of 2, suppose you get to know that these are the developmental delays and this is where the child is showing regression, it's better to work with the child there and then in terms of occupational therapy, speech therapy, sensory integration, special education, and physical development, all the 5 areas. which also, when it comes to small children, it includes a lot of play therapy also in it. With all of these elements, of course, working with a 2-year-old will always give faster and better results rather than working with somebody who's 8 years old.
Interesting. Okay. Every parent asks, will my child ever become independent? What does independence actually means or looks like in autism?
See, I think the definition of independence is going to be different for everyone who's sitting here. You know, independence and freedom, I think these two words have always been used and misused as per each other's convenience. So, the answer to this question is that independence for every child with neurodiversity is going to look very, very different depending upon how your child is progressing and how your child is growing up with you, without you, whatever. So there is no confirm answer that will my child be independent. I might say yes when I work with your child today and I see that your child is doing all the ADL and IDL activities on his own, and I would say, okay, fine, your child is already independent. Now your child can do everything on his own. And after 2 years, you would come and tell me, ma'am, ये तो t-shirt भी नहीं पहन रहा है खुद से. So there is no definite answer to it. The definition of independence is very different when it comes to autism.
So, Nisha ji, what is the difference between ADHD and autism, and how do parents recognize, early signs of ADHD versus autism?
Okay, so when it comes to neurodiversity, there's a very thin line between all the neurodiversities. So, of course, there are fantastic tools to find out whether my child falls into the spectrum of ADHD or my child falls into the spectrum of autism, or it is a combination of two, and it also might have learning disabilities. But the biggest difference is that regression usually doesn't happen when it comes to only ADHD. So let me make it clear. Suppose if your child is only having ADHD, only diagnosed with ADHD, you will not see regression. The progress will be seen maybe slowly and steadily, but there will be progress. But if the child is a combination of ADHD and autism, or only autism and learning disabilities, or one of them, there will be regression also when it comes to autism. So that's the biggest difference. So rather than looking at eye contact and how much my child recognizes and how much my child writes, how much my child reads, more than that, the parent should be focusing on progress and regress.
Right.
That's the basic difference between the two.
Right. And when it comes to, for instance, ADHD, what are the early signs that parents can look at?
So, see, ADHD has to do a lot with attention, concentration, and hyperactivity. So, now this I can say that, it has a lot to do with food. It has a lot to do with sleep. I mean, your own self-management, that is your regulation. And it has a lot to do with how much movement are you giving to your body. And in today's time, if you see, most of the kids are struggling with all the three things.
Yes.
Food is something that nobody knows better than you, that what are the kind of struggle they have. Sleep is challenged. Even young children are only sleeping for 4 to 5 hours because of the screen time that they have. And movement, because there is no free play. So free play is, I remember what I used to do as free play is we used to go out of the house at 5 o'clock and we used to decide what are we going to play today. That's free play. I'm not telling about being the child constructive. Most of the parents का आजकल ये भी है कि हमारा child बहुत productive और constructive रहे. I mean, if there is no boredom, there is no creativity. Why aren't parents understanding this? There has to be boredom for creativity to happen, and it's very simple science. So ADHD, again, it is a lot about attention, concentration, and hyperactivity. So there has a lot to do with food, sleep, and movement. So less movement, of course, hyperactivity के chances है because the energy is not channelized. Food, where the, who knows better than you that what goes inside is something that is going to come out.
Right.
So food and sleep, because if the nervous system is not relaxed for 8 to 9 hours and it wakes up in a very hyperactive mode, it is going to be difficult for a child to regulate it. So these three things are very, very important when it comes to ADHD. इन्हें चैनलाइज करने के लिए अगर ये तीन चीज पेरेंट्स इतना सा भी अगर कर लेते हैं, rather than sending to classes and rather than keeping them busy throughout the day and keeping them on the edge throughout the day, if they just take care of these three things, that my child sleeps for about 8.5 hours every day, my child eats clean food and the right food every day, and my child moves for at least 1 hour to 45 minutes every day, I think a lot of, even if the child is diagnosed with ADHD, a lot of things can be managed.
Interesting. And how much of ADHD is lifestyle driven and how much is genetic?
So genetic, science is still studying about it. Lifestyle driven, I would say 65%. So imagine if lifestyle is improved, a lot of areas of ADHD can be taken care of just with lifestyle.
So a lot of times I've heard from ADHD, diagnosed individuals that they zone out, right? This is like seen a lot. So how can sleep, movement, food impact zoning out?
Sleep, of course, will help. In fact, all three will help because all three are related to regulation. All three are related to your nervous system, and all three will help you to self-manage yourself in a better way. But the question is what to do when you know that I zone out. Right? So most of the parents also ask me this, that it's a 45-minute class in the school and my child, like after 5-10 minutes उसको पता भी नहीं होता है कि class में क्या कर रहे होते हैं. So even at schools and even at home, we tell that after every 15 minutes, give a small movement to your child. And this is required even in schools today. So at home, how you can do, now your child is watching television, just go and tell your child that remote ले लो, remote थोड़ा दूर रखो. Give that movement of taking the remote and changing the channel. Get up and have a glass of water. If it's eating time, don't give it near the TV. Call them to the dining table, eat and then probably go back. So this movement will help them for the brain to be active. Now brain को active रखने के लिए आपको क्या करना है? सिर्फ आपको brain को distract तो करना है from one thing to the other thing. The moment you learn to do this and the moment you understand that this is helping you, you can have it in your own day-to-day life. So when older children who are preparing for exams and if they are having some symptoms of ADHD, so they need longer hours of concentration and attention. So we always tell them this, that the Pomodoro, that 25, 25, 25. So now this movement that they add after 25 minutes will help them to sustain for a longer time. But this movement shouldn't be this कि आप यहाँ से इस chair पे आ गए and then I'm scrolling. So the movement has to, the body should feel, the brain should feel that my entire system is moving. So you go for a walk or you're just strolling around in the house, give 5-10 minutes for the body to understand, and this will definitely help the child or the adult to manage the zoning part.
Disassociation.
Yes.
Very nice. So modern parents spend more time with their children than ever before, yet childhood anxiety is rising. What has changed?
What has not changed, I would say that. So in spite of modern parents knowing a lot of things, they're aware of so many things, but I think the correction part is just not going out of the system. So a lot of Instagram reels and many of them who call themselves as therapists and parenting coach and all of that, they would tell that, as parents, go and ask your children what is your big emotion and what is your small emotion and what do you do when you're angry and all of that. All of that is good. It's good if you can do that. But most importantly, I think stop correcting your child for every small little thing. And if you want to correct the child, especially modern parents, first build that bond. You will only listen to a person if you love that person unconditionally. If you love somebody with conditions, आप ये कर लो तो ये हो जाएगा, तो आपका रिलेशनशिप नहीं है ना, वो तो एक बिजनेस डील चल रही है आपकी इतने सालों तक. So if you just take out the correction part, connection has to happen. Where will it go? Because you're eventually, there's blood relationship. Eventually you're with the child for 24/7. And why is the connection not happening? There must be something, right? You're doing everything right. From food to materialistic things to outings to travel to classes to best of the school, and still you feel that my child doesn't do this much for me. Because deal abhi tak crack nahi hui hai na uski side se. It's so simple to understand. These are logics, but as parents we don't think that way. So if you have to take the deal out of it, take the correction out of it, and the connection will happen. It might take time. I'm not telling you stop correcting today. So I'll tell you one very nice thing. Parents stop correcting verbally, but body language तो correction वाली ही रहती है. इसीलिए डील क्रैक नहीं हो रही है. So emotionally, socially, and physically, you have to stop the correction part, and that's where the connection happens. And it will happen. It takes time, but it will happen. And when the connection happens, I'm telling you, parents, it's so beautiful because that's where the real relationship starts.
Right. Wow. Okay, so many parents think love means protecting children from discomfort. Are we accidentally raising kids who can't tolerate frustration?
So there is no yes or no for this answer, but I would tell parents, no matter from what status you come from, please let your children do everything on their own. Everything. Right when they start walking. जैसे ही वो चलना स्टार्ट करते हैं, let them do everything on their own. If they want to drink water, let them go and have a glass of water. If they want to eat something, let them go and tell their caretaker, I want to eat something. Do not give them anything ready-made. Now, if you give everything ready-made, frustration is about to come into your lives. So if you want your children to not panic in difficult situations, if you want your children not to get frustrated in difficult situations, in short, if you want your children to be resilient, just let them do everything on their own. Right from packing their bags, going to the school, waiting for the van, everything. And trust me, they can do it. Parents feel that they can't do it. Abhi bachcha hi hai. अब ये बच्चा ही है, पर वो हर चीज कर सकता है if you allow the child to do it.
And I think most of the times parents are also like कि ऐसे नहीं करना है, ऐसे करना है. That's the
because
reason
that's how they have done it.
Right.
So when you go to schools in Japan, children as young as 4 and 5 years, they're cleaning their classrooms, they're cleaning their washrooms, they're cooking. The older children are cooking. Everything they are doing, what they do at home, they're even doing it at school. But in India, we don't do that. There are very few families where you see that the children are even doing household chores, or they would be some part of decision making at school. नहीं तो बच्चे इनको क्या समझ आएगा? आप पूरा सिस्टम इनके लिए चला रहे हो और इन्हें समझ नहीं आएगा. How can you do that? इन्हें ही समझ में आएगा. And when you involve them, things change. And we are seeing what is happening even politically. When you involve, because it's for them. Just to say it is for them, but eventually it is not, right? And that's why so many challenges.
So what is emotional regulation, and why do some children recover from disappointment in minutes while others melt down for an hour?
Okay, so firstly, meltdown word is a huge word, It shouldn't be used so lightly. Anxiety, depression, they're used so lightly. I met somebody who was in grade 4, and there was some competition in the school, some singing competition in her school, and she was very upset. So I entered into the classroom and I was like, "What is wrong with you?" She said, "I'm depressed." I said, "You're depressed? Why are you even depressed?" She's like, "Because there was some competition and I'm not selected." So I said, "Why can't you say that I'm upset? I'm sad.
Yes.
Why depress? I mean, when you're not well, or if I have throat infection, I would not say that I have typhoid, I have cholera, or I have malaria, or all of the things. I would simply say I have stomachache or I have throat infection. या मुझे बुखार है." We are so scared of taking these big names when it comes to medical diseases. But when it comes to mental disorders, we use it at our convenience. I'm feeling very anxious. I'm feeling very nervous. Though these are such big words that, people and children have started using very loosely. And sadly, the older children and the young adults, even in MNCs I have seen, because we take sessions with MNCs, it's so easy to get leaves when it comes to, telling them mentally I'm disturbed, I'm having trauma, or I'm depressed, I'm anxious, mentally I'm not in the good space. I don't know. Is it because MNCs and government bodies are now very scared of these terms and legally they can actually create a havoc or something like that? But people are literally using it just for benefits, that koi fayda ho jayega usse. But coming back to your question that why a person will behave like this and why a person will behave like this with disappointments is definitely, if it is, we are talking about neurotypical people, then definitely depends upon the upbringing of the child. So if the child is resilient enough, even with bigger disappointments, the child would be ready and to take charge and like, okay, fine, yeah, I'll do it. But if the child is not resilient, no matter what you do, no matter what consequences you build around the child, it is going to be very difficult for the child to accept that disappointment. So that's why in your previous question I said, please let your children do everything on their own. With the mistakes they will learn, and with those same mistakes they will become resilient. And that will help them to handle rejections and disappointments when they grow up.
Right.
So you cannot teach a 25-year-old to handle disappointment and rejections when he's just faced it. But you can prepare the child when he or she is 5 years old to handle that when he or she becomes 25 years old.
Right. And that brings my mind to your first statement is mind your own business and let them do what they want to do.
Exactly.
Right. So the circle is complete. Amazing.
So I have my mentor in Bombay, जिनसे मैंने पढ़ाई करी है. He's no more, sadly. When I was doing child development with him, he was my professor and research guide also. So he had, we were just talking about child development only, and he said, बच्चों को किसी की जरूरत नहीं है, बच्चे खुद पल सकते हैं. पेरेंट्स को ऐसा लगता है कि हम पाल रहे हैं. So they do what makes them happy, not the children happy.
Right.
So the entire child development, when we studied about child development, it is children-centric. It is not parent-centric. But parenting is completely parent-centric. It's not children-centric.
Right.
And that's the tussle I feel, it's there.
Correct. And I think a lot of times, half of the times parents are trying to raise their children for things that they've not got, or what they wanted to do, what they wanted to become. So it's almost like living your life through them, so that becomes very controlling most of the time.
And now for the society and Instagram also, no?
Yes.
Yeah.
Yes, absolutely. Okay. Children rarely say I'm anxious. Instead, they complain of stomach aches, headaches, poor sleep, anger. How does anxiety hide inside the body?
In all of these ways that you have said, especially when it comes to young children, it's mostly stomachache and toothache, mostly. And a little older, it's also watery eyes, sleepy eyes, headaches and body aches. So anxiety stays in the core, as we say, when as a mental health professional, I would say, it stays in the core. And when the core is not able to handle, which lot of times the core is not, because सबकी अपनी capacity होती है. So जब आपका core उस anxiety को handle नहीं कर सकता, it comes out in different ways. Again, it is a lot to do with age also. So very simple, I'll tell you. There's somebody we are working with who's 41 years old again, and struggling with severe anxiety. Now that severe anxiety has given kind of skin problems to that particular person. So, she'll have these big red marks in the morning. Sometimes it will be around the lip, and it's like huge. She's got all the possible tests on this earth done, and there's no problem inside the body. But there's a lot of problem inside her head.
Yeah.
And that entire thing is held by the core. And then the core will take it out in whatever form the core wants to do it. And nobody can control that.
Right, absolutely.
So, it comes in form of skin issues, it comes in form of hair issues, it comes in form of eye issues, it also comes in form of ear issues. So, yes, stomach ache, headaches, a body ache, not wanting to eat, or hunger pangs, sudden hunger pangs, बिल्कुल बिना मतलब बे टाइम पे जिसको हम बोलते हैं रात को 3 बजे भूख लगना, 4 बजे भूख लगना, all that is part of anxiety.
Interesting. You've often spoken that nutrition is one piece of child development. Without exaggerating, what can food genuinely influence? Attention, mood, sleep, behavior, learning?
Out of these, everything, each and everything. As far as I remember, in the last 18-19 years, whatever therapy sessions we've taken with the child or any adult or even senior people, in the report, we've also mentioned modifications for food, modifications for the timing of the food, and reference to a nutritionist or a dietitian to manage their food habits properly. So it is completely correlated to each other.
Right. Parents hear phrases like gut-brain axis thrown away. What does that actually mean inside a child's brain?
Okay, so there's a very nice Hindi phrase जो मैंने कभी अपने बड़ों से सुनी थी कि जैसी आत वैसी बात. तो I completely agree with it, completely. And in my recent research work that I've done for ADHD and autism, completely 100% approval on the gut-brain axis. Completely. So if the gut is right, if the food is right, our axis, not the AXIS, our access for the therapy with the child is always better, and we can get very good results. So, agar कहते हैं that sugar and salt should be controlled with ADHD, it should be. अगर कहते हैं कि processed food नहीं खाना चाहिए when it comes to autism, not even a little bit, I 100% agree to it, and it's definitely, again, I would not deny on the gut-brain axis.
Right. Amazing. Because a lot of the patients that we work with, we also hear the same, that their therapist has given a positive input with changes in the food. They see that, like you said, there's more access to the children that they get when they want to do some sort of therapy. So
totally. And this realization has come to us in the last, I think, 5-6 years, that there is not little modification, but there are bigger modification that is required when it comes to food and mental health, food and neurodiversity. And that's also one of the reasons that we had physician, we had a psychiatrist in our panel, we had a occupational therapist, speech therapist, everyone for so many years. But in the last 4 years now, we have a nutritionist in our panel, and we feel that her role becomes bigger, and after our intervention, her role is the first role, and then they move to the other therapist, because unless they do those modifications, any other modification is not going to work.
Okay. So could chronic constipation, poor sleep, and selective eating all be connected in some children? Walk us through that connection.
So I think we just discussed that how food, movement, and sleep all plays a very important role in any individual's life. Similarly, yes, because if constipation means there is some issue in the gut, poor sleep again, because the gut is not right, the child is not able to sleep well. And the third is
Selective eating.
selective eating. I think selective eating also has to do a lot with how the family also eats in the in
Yes.
the house, because this I think is very common. I would say that if the parents are selective eaters, even children come out to be selective eaters. But when it comes to neurodiverse, because their taste sensory at times is very high or it's very low, so getting them to eat everything is not that easy. But when it comes to neurotypical, the selective food is basically comes from the family. So when a family would sit and eat together everything that's made in the kitchen, usually children are not selective eaters. But when so even modern parenting also has this, I would say, as a drawback, that there's A thing made in the kitchen, but the child wants to eat the B thing, so the B thing will be made for the child, and then the child will enjoy that B thing, and the parent is very happy that my child is at least eaten. But now there is two things that has happened. The child has not learned to eat what is available, and what the entire family has eaten. And second thing, the child is not becoming resilient. Of course, you can tell the child that the same thing will be made for you tomorrow. Let us make something that is your menu tomorrow. Today it is this menu. Let us all enjoy that. So when the child learns to wait, understands the importance of others' choices with his or her choices, the child becomes resilient.
Right, absolutely. If a 6-year-old eats packaged snacks, sugary drinks, and ultra processed food every day, what happens to their brain over the next 5 years?
Do we even need to answer this? Because the question itself is, what will happen to the brain, specifically to the brain?
Because I think, unfortunately, this is there. Children are
Eating processed food and all of that. So the child, of course, the cognitive development that we say of the brain. So again, neurotypical के लिए अलग होगा, neurodiverse के लिए अलग होगा. Let's talk about the general, the generic thing. But yes, the cognitive development, the impact of critical thinking, decision making, problem solving, all of that is going to impact. Maybe the child does very well academically, maybe, which also I doubt is not possible. But maybe let's assume that the child is doing, because parents के पैरामीटर ये होते हैं कि क्या हो गया, खा रहा है तो मार्क्स कितने अच्छे आ रहे हैं, मैम इज फैबुलस in the class, he's cracked this falana exam in this falana college. Agreed, but it's not only about that academic development. We are talking about development which has a lot of critical thinking. It has decision making, problem solving, creative thinking. All of that is definitely going to hamper.
Right. And these days, a lot of times when teenagers come to us and it's their exam time, the parents say, we have to let them eat because they're studying. So I think an answer from you definitely brings in some light
to,
yes, is it really important or not important, especially when they're studying?
Not important. It is never important. Processed food, junk food is never important. Now, see, the word only has junk, right? Now, what else do you want to hear?
Right.
And the second thing is, all of these things are supposed to be enjoyed, occasionally. So, when there is something that you should be eating occasionally, and when you start doing it on a regular basis, and these foods are addictive. We've worked with children who are addicted to burgers and pizza. They cannot eat anything else other than that. And it was very difficult to take them out of it. So there is something, of course, not right in that. And if they eat or they don't eat, ऐसा नहीं है कि खा लिया तो they'll crack the Harvard and the Oxford, और नहीं खाएंगे तो रह ही जाएंगे. ऐसा तो है ही नहीं. So setting up the relationship that, just because they are not eating and they want to achieve something, so it's better that they eat. is, I think, is not right. I think it's nonsense. I would say that.
Right, right. What is one parenting trend that is becoming popular but worries you professionally?
To be available for the child all the time, and to keep their children busy all the time. This really worries me, that boredom is going out of parenting. So parent gets very scared if the child is just lying down on the sofa and looking at the ceiling. They feel there's something wrong in this. How come my child is even wasting that 10 minutes? So this really worries me, because it's not far that we will have very less creative people around us in about 10 years down the line, because parents are not letting their children to get bored. They all the time want stimulation, and they are offering stimulation to the child all the time. This really worries me.
Right, right. If every new parent had just 1 hour class before bringing a baby home, what would you teach them?
What would I teach them? How not to do corrections at home as soon as you have the baby. Yeah, I think that would help them to bond with their child from day one.
Right, right. But I think it's just the opposite, right? As soon as we see the child, it's like, ye gora hai, ye kala hai, ye chota hai.
It begins.
Mota hai.
It just begins. Yeah.
Right.
इसके बाल ऐसे आ गए, उसको ऐसे हो गया, इसको. I mean,
Right.
I think how not to correct anything around the child for few years.
Yes, yes, yes. So profound. Right. What's something that you've learned about autistic children that every adult should know?
I think two very beautiful things. First, which is very difficult for us as neurotypical, to be authentic. And second, to love unconditionally. So when autistic children accept you, they want nothing in return. How beautiful is that? I don't remember any relationship around us today which is like this, that you love that person and that person wants nothing from you. How can that be possible? So I think these are the two beautiful things I have learned from them. Love unconditionally, because love is unconditional, no matter what. And be authentic.
Right, right. Perfect. So we move to the rapid fire now.
Oh,
Okay. Okay. First, biggest parenting myth.
perfect parenting.
One behavior a parent should never punish.
Crying.
Most misunderstood symptom of autism.
Eye contact.
One food you'd remove from every child's lunchbox.
Momos and Maggie.
One habit every family should start tonight.
At least one meal together without any gadget.
Right, right. Screen time, enemy or tool?
Depending how you use it, it can be a tool, otherwise enemy.
One sentence every child deserves to hear daily.
I love you.
Right. One sign a parent should never ignore.
Crying.
A childhood behavior that's actually healthy but parents panic about.
Crying.
One thing adults could learn from autistic children.
Acceptance.
Perfect. Thank you so much, Nisha ji. It was amazing to interact
Thank
with
you.
you. I think I learned so many things.